Go ahead.
Hello, See Her Soar. It's me, Jenny, again, here with one of my favorite people. Her name is Nicole Yates, and she's with Bayside Pediatric Therapy. Now, the reason I'm really excited to share Nicole with you today is a personal one because Nicole is my daughter's speech therapist. I have four kids. My third child is Rory, she's 6, and she has a disorder called apraxia. What that means is that her brain has trouble communicating with her mouth. So she understands a lot more than she's able to say. And when I brought Rory to Nicole at 4 years, she'd already been in speech for several years, had made no progress. She had almost no words. And my mama heart was getting kind of freaked out because I didn't know if my baby was going to be able to talk. So when your child has speech issues, finding the right speech therapist is so important. And when your child has something like apraxia, which is a kind of complicated disorder, it's kind of rare, finding somebody who knows how to deal with it is super important. So Nicole is amazing, number one. And she is trained in a kind of therapy called prompt, which helps kids with apraxia be able to learn how to motor plan sounds so that they're able to talk. And she also uses something called AAC, which is using a device like Nicole is showing you right now. So children that are nonverbal have a way to communicate. So we're going to talk a little bit about that today. But first of all, let's let Nicole talk a little bit. Nicole, can you tell us a little bit about yourself and your background and how you got where you are today?
Yes, I am a speech therapist, like you said. I had speech myself as a child, so I kind of understand the frustration a little bit about not being able to be understood. So I kind of knew from high school that's what I wanted to do. So that's strange. There's not many people who knew they wanted to be a speech therapist in high school, but I am. And so I've worked in a lot of different settings over the years. I've been home health, I've done early steps, I've done other clinic, I've done a hospital, and then I just decided that I wanted to kind of go on my own. I left about 3 years ago and start my own clinic just so I could spend a lot of time improving myself as a therapist, doing a lot more continuing education so I could really help the kids and not just see them as a number, which can sometimes happen in that setting. So yeah, that's why I became a speech therapist.
Well, we're very glad that you did.
Thank you.
But Nicole is the one who really helped Rory learn how to use what we called her talker, her device. So I asked Nicole to bring one of those today so that we could show you all, because I know a lot of us in this community are parents. I'm not sure how many of you have little kids like I do, but I think parents generally get a little freaked out when they start noticing that maybe their kid isn't talking or developing properly. Um, I know that because Rory was my third child, I made a lot of excuses. She wasn't putting words together. And I said, oh, well, she has two older brothers and they're talking for her. So we waited longer than we should have. But when she was 20 months, we started her in early steps therapy, doing early intervention, which I think is really important, right, Nicole?
Yes.
Yeah, early intervention is crucial. So I always encourage parents, like, if you have that gut feeling
Mhm.
that's telling you that something might be a little off or that something's not the way it's supposed to be, don't wait and see. Like, go take your child to see someone. Get in touch with the early steps or the developmental people in your area. Take them to a speech therapist. Get someone to evaluate them, because the earlier you can intervene, the better. And with Rory, I was really worried that when we got her a talker, a device that
Mhm.
allowed her to communicate without her words, that she wouldn't learn how to talk.
Mhm.
And Nicole told me then, like, don't freak out about it. So you want to give a little explanation on what you tell parents?
Yeah. So like the majority of the people who come to my office are parents or kids that aren't talking yet. And there are 2 or 3 usually, sometimes 4, and the parents are concerned. So there's a lot of reasons for that. And we usually start with sign language, and then we go to maybe a picture program and then a device. Not everybody needs a device. I don't always go here first, but I do a lot. So this is an app on my iPad, but there's also a device that goes with it, and that's what Rory had. I just accidentally left it at the office. There's several different communication apps and devices that you can use. The one that Rory has is covered by insurance. Right now in
Yep.
Florida, an app like this is not covered. So it's actually easier to go get one through insurance than it is the app.
And we did both. We had the app on an iPad first while we waited for insurance, and then once we got our device, we switched her over to that. But it's using the same program, so I think that's really cool that she could learn how to do it on one device and then switch over to her actual device when she got that.
Or if it ever got broken, you'd always have a
Yeah,
backup.
we had a backup all the
This
time.
is their voice. And like I said, when those kids come to me, they're very frustrated, and it breaks my heart every single time I see a kid come to my office. And they're 3 years old and they can't say, "I want juice." Like that just breaks my heart. So that's why let's give them a way to communicate first, and then we can talk about speech. So like here, this button, like I can say
More
more,
bubbles.
more bubbles.
Please. More bubbles, please.
Very
So-
cool.
Yep.
And that's something, all little kids want to be able to say is they want to ask you for more. They want to ask you for a snack. They want to ask you for their favorite show or to see their grandma or their brother or their dog. So the devices allow children to be able to communicate and
Right.
get their basic needs and wants met, which really that was what Rory used it for in the beginning was I want this, I want this, I want this. She finally had a way to tell us what she wanted, which was amazing.
Yeah. And I always say my favorite thing is, I don't know if Rory had this moment, but with most of my parents, when I teach them love,
Yeah.
the word love, and then I give them a hug, and then they start using love to tell their parents they love them. That's
Very cool.
It's the best. So
But what I found with Rory was that she was getting this constant reinforcement. So every time she would use her device, she would hear the words as she said it, and then it would repeat the words if you push the button at the top. So she was constantly getting that auditory reinforcement of the words that she was learning. And what do you know? She started talking. It was kind of amazing. So a lot of parents are afraid, like, oh, now they have this crutch that they don't need to learn how to actually speak. Well, we really didn't find that to be true. So I know Nicole always tells her parents that, and I always like to share that with people as well, that if you have a nonverbal little kid, this is a great way to give them a way to communicate to really ease that frustration level.
yes.
To help them in the early days. And then Nicole works with prompts. So
Right.
you want to show us some of the prompts on yourself, like how you're
Sure.
actually showing them how to make sounds?
They're a little hard on myself, but I'll try. So once my kids start communicating, then I say, okay, let's get them talking, see how they repeat words, and then we can fix why they aren't saying the words, like the apraxia, the having trouble from the brain to the mouth. So like, I'll show you some prompts, but I would do it on their face. Like we'd start with like go, because a lot of go or oh. A lot of kids have trouble
We do a lot
running
of lip
lips
rounding.
and retracting. And they
Yep.
also, a lot of kids have trouble with opening their mouth and shutting it. So a lot of my kids come to me with their mouths fixed like this, or just not having any range of, like their range of motions all over the place. So we start with like pop or pop. So they're not sliding from side to side. So
But
yeah,
that was really amazing for Rory because her brain and her mouth just couldn't communicate properly. So she just didn't know what to do with her mouth to make the right sounds. So a lot of things were, the same sounds over and over again. Ba, pa, ma. The easy sounds that she has trouble with the lip rounding and the retractions and the G's and the K's. So Nicole really helps her to learn how to make those sounds. So since Rory's been with Nicole, she went from just having some approximations. She couldn't really even say it was ma, ba, pa. Now she can say words. She can put together sentences. She's learning a whole bunch of different sounds. So Nicole has literally helped my child have a voice, which is one of the most amazing gifts that anybody can give to anyone. So that's why I'm excited to share her with you today because she is amazing. And if you have a child who you are concerned about, if you're in the Tampa Bay area, she's an amazing resource to have. And if you're not, then, reach out and start figuring out ways to get your child some extra assistance and help. It's very possible that they won't need it for very long. But if your kid is like Rory and your child does have a disorder that needs that extra intervention, starting early is the best thing that you can do. So I highly recommend that either you get Nicole in your life or you get someone like Nicole in your life if your child needs that assistance. So thank you, Nicole, for hanging out with us today. Can you tell us goodbye using your talker?
Oh, yeah.
We're going to learn more about Nicole today. But I wanted you to see her lovely face and goodbye. And get to hear a little bit about what she does. So thank you, Nicole, for chatting with me today, and we'll talk to you soon.
Sounds good. Thank you.
All right.